My name is Don Scott, and I am a physician. I am an internal medicine doctor and a geriatrician. And my role here in CARE is I'm the medical director, so I am the doctor that sees the patients when they initially come in for their first visit. And my other job is I teach in the medical school here, so I'm a full-time faculty member at the med school. I think probably the most important thing is that as a geriatrician, one of my roles is to care for people that may have dementia, to evaluate them and to care for them. Well, my father had Alzheimer's disease, and so this condition, dementia, is something that's near and dear to my heart. And I have had other various roles as a geriatrician doing primary care and things like that. I've now transitioned over just to helping take care of people and diagnose people that have cognitive impairment. And so when Lisa and Janae started the CARE Clinic, because I only work about 400 feet away over in the medical school, it was a natural thing for me to come over here and to be the geriatrician doctor for the CARE Clinic. In the care center, what I do is I see people during their initial visit, and so I do a history of physical examination. We look at their records and other things, and most people come to us either because they themselves are concerned about their memory or their cognition, or a family member is concerned about that. Sometimes we have people come in rather and say, oh, there's nothing wrong with me, I'm here because my daughter, my wife wanted me to be here, or something like that. So I see them for the initial visit, and then we decide whether or not additional testing might be needed. So for instance, what Dr. Correa here does is he does what's called neuropsychological testing, which is very, very detailed cognitive testing, not only memory, but other areas of cognition. So sometimes that very detailed memory testing is needed, and sometimes not. I have a little memory test that I do that's like a low-powered microscope. Dr. Correa has the high-powered microscope. So after the first visit, we decide, are there other things that need to be done, or can I make a diagnosis right now? And probably 75% of the time there are other things that need to be done, for instance like a brain MRI, or they need to see Dr. Correa for neuropsych testing, or they might need some additional blood work. I typically see 2 to 3 patients a week. This is not, a place where we're here to generate a lot of patient visits, and so we have a lot of time with the patients to go into things. And it's not only about diagnosing patients, it's also about education and support. So Dr. Saint, who is our social work lead, she works with her students and she sees the patients as well. And then, as I said, if Dr. Correa needs to see the patients, then we have a clinical pharmacist who can evaluate the medications. So we have this whole multidisciplinary thing going on here. My dad was 57 when I was born, so if you think about that, he was 74 when I was 17. My mom was older. We lived with my maternal grandmother my whole life. So number one, I've been around old people my whole life, or older people I should say, because I'm one now, I guess. And so my heart goes out to older people and the problems that they had. Then I saw what my dad went through with Alzheimer's disease and what my mother went through, trying to take care of him. And then we had my maternal grandmother who had other kinds of, problems that are common in older age. So even though I've lived in the big city and I've lived in the medium city and I've been here and I've been there, I think that there's a lot of need just in general. Besides the fact I grew up in a rural area, there's a lot of need in general and there's not a lot of service. And so that's one of the missions of our clinic. We go out all over the state to try to help communities with care and services. And whatever they need, it's not what we think they need, it's what they need. That need is very great because the nearest geriatrician or neurologist might be, 100 miles away in some of our really rural communities here. So it's also kind of a need-based thing. Want to serve those in need. For me, the connection really, it has to do with getting to the other side of what it is to understand and take care of people, because science is one thing, but art is another. And so through the arts, I think we can understand people in a different way than we can through science. And then the other thing that's really interesting is that music lives in a very mysterious part of the brain, in which I've had patients that have pretty severe dementia, but you start singing a song that they know and they'll just chime right in. And I'm sure you guys have seen videos of people that look like they're extremely demented and then they just start playing the piano like, you know. So it's really interesting. Music is a special and different thing than a lot of the areas that we have for memory and for our other cognitive functions. And you can reach people more, I think, with music than, you know, and the same is true for art and dance, but I think especially music, because everybody pretty much listens to music and has their favorite songs and things like that. And I think it's a very, very special thing. And I think music therapy is very important. And of course, we have a music therapy group here. The ability to make connections with patients and the family, because I have a whole lot of time to spend with people. So I can go very much in depth to like what's been going on, not only medically, but, you know, psychosocially, because very often people that have these kind of cognitive problems, there's a lot of psychosocial issues that, you know, there might be depression, there might be, you know, a lot of stress or anxiety in the family as well. So we can talk about those kinds of things. It's having that time to spend with patients and their families, and best as I can to try to explain, you know, here's what we're talking about in terms of the possible conditions. Here's what we're talking about in terms of, you know, what that means. And yeah, just finding out about their lives and, you know, what's been going on. Now, of course, we do research here as well, and I'm involved in that, and, you know, that's very rewarding. But as a clinician, it's always been for me that personal connection with a person is the most rewarding thing.